when the COVID-19 pandemic, hit the international scene around December 2019 and early 2020, one of the things that we realized in our clinical services program was that we needed to know the capacity of intensive care and critical services in the Pacific. And so we went on to develop a critical service survey for our Pacific Island countries with our team here in public health. And we managed to get results from 12 Pacific Island countries with 16 hospitals reporting on their intensive care and critical care capacity. And this was not only with the resources that they had in their hospitals, but also the health workforce, both the clinicians and the nurses. And we also needed resources like equipment for, ICU, respiratory support, ventilation as well. And so this was instrumental in getting the development partners and our funding agencies to look through this report and say that, okay, so these are the help that we are going to provide. I think the challenges that we faced during this COVID-19 was the border restrictions and travel restrictions that countries imposed, which means that we could not travel to countries and conduct these trainings, and so we had to do this virtually. And that in itself was a challenge because this was something that we were pretty new at, and we had to learn as we went along. For this year's International Women's Day, which is Pacific Women in Leadership, Achieving an Equal Future in a COVID-19 World, is very important. Our program is also, provides a leadership role and mentoring for Pacific Island women, our nurses. And this in itself is actually a good, timing where we can reflect, the work of the nurses, our healthcare. These are our frontline workers, be it critical care or emergency, medicine. And the bravery that they have in bringing, keeping themselves safe and also working for the betterment of our populations, especially if we have COVID-19 cases in, the Pacific and more so here in Fiji.